Imagine trying to speak, but the words just don't come out the way you intend. Your mind is sharp, but your muscles don't cooperate. For millions, this is a daily struggle. This is dysarthria. But what exactly is it? Dysarthria is a speech disorder at the motor level due to damage in the nervous system that causes different kinds of difficulties in the muscles responsible for controlling speech. There are many types of dysarthria, and they also vary greatly in severity. The most severe form of dysarthria is called anarthria, which means a complete loss of speech. Commonly, people tend to confuse dysarthria with several other disorders, even though they can be very different conditions. One of them is aphasia. The biggest difference between these two disorders is that aphasia occurs when a part of the brain responsible for language is damaged, affecting language, which is the cognitive part of trying to communicate. This includes thinking about words and recalling them, understanding language whether it's oral or written, and organizing sounds and words correctly. In contrast, dysarthria is caused by neurological damage that affects the muscles needed for speech. It only impacts the motor aspects of speech. Another disorder that is confused with is speech apraxia. The difference is that dysarthria is a problem with the muscles needed for speech, while apraxia is a problem with the ability to plan and organize the movements needed for speech production. In fact, a person with apraxia can move their muscles without difficulty. For example, if you ask them to open their mouth or stick out their tongue, they can do it. However, if you ask them to speak, they are unable to coordinate the movements in the correct order to produce speech. You can learn more about apraxia here. It's worth mentioning that there is also a high prevalence of dysphagia in patients with dysarthria, as the same muscles that affect speech can also impact deglutition. The cause or lesion site of this condition depends on its type. There are 5 main types of dysarthria as well as some mixed forms. The most common type is spastic dysarthria, which is caused by a bilateral upper motor neurons lesion. That can result from conditions such as stroke, traumatic brain injury, neoplasms, central nervous system infections, and degenerative diseases, among others. It is characterized by imprecise articulation, monotone voice, resonance, and altered prosody. The muscles are rigid and move slowly within a limited range. Effort is noticeable when speaking, and words are sometimes prolonged. The most common characteristics include strained voice, slow speech, distortion of consonant sounds, and hypernasality.
It's a boy, I'm not sled.
The second type is hypokinetic dysarthria. It results from a dysfunction in the basal ganglia, affecting the extrapyramidal system. One of its most common causes is Parkinson's disease. It is characterized by muscle rigidity, difficulty initiating voluntary movements, slowness, and resting tremors. The voice is weak, hoarse, strained, and interrupted. Inappropriate pauses occur during speech, and prosody may exhibit monotony, and also a lack of variation in volume can be present.
When I was 36, which is back in 1996, which we'll have you guys all calculating, it took 3 years because it was kind of unheard of for young people to have Parkinson's disease then.
Another type is hyperkinetic dysarthria that originates from damage to the basal ganglia, leading to excessive abnormal muscle activity. It can be caused by diseases such as Huntington's disease. There are 2 proposed subdivisions: the predominantly fast type, which is characterized by distortion of consonant sounds, inappropriate and prolonged pauses, variable rhythm, monotony, a rough voice, variable intensity, and episodes of hypernasality. On the other hand, the predominantly slow type produces sustained involuntary movements that disrupt the speech process.
Like the girls have in Vancouver.
Sure.
Yeah, they're younger and
If this video is useful, please subscribe for more content. The next one is ataxic dysarthria. Occurs due to a disorder or injury in the cerebellum. The most common causes include strokes, traumatic brain injuries, cerebellar tumors, and cereballitis. This injury leads to ataxia, a motor disorder characterized by a lack of coordination in performing voluntary movements. It's often compared to the behavior of someone who is drunk, particularly in how they walk or speak, to create a mental image of it. This ataxia is reflected in speech, affecting articulation and prosody. There are severe and inconsistent articulation problems, with syllable separation marked by prolonged and inappropriate pauses. Additionally, the voice may be rough, with variable and uncoordinated rhythm and tone, along with consonant distortion and exaggerated accentuation. The fifth type is flaccid dysarthria. It results from the involvement of the lower motor neuron of the cranial nerves involved in speech. This condition arises due to damage either at the motor nucleus level, its axons, or the neuromuscular junction. Causes can include stroke, traumatic brain injury, amyotrophic lateral sclerosis, neuritis, myasthenic syndromes, and various dystrophic muscle processes. It manifests as flaccid paralysis with weakness, hypotonia, and muscle atrophy, with fasciculations possibly present. These symptoms are reflected in a breath frothy voice, weak and lacking resistance, along with hypernasality and consonant distortion.
When the sunlight strikes every drop in the air,
Finally, mixed dysarthrias result from impairments in two or more systems involved in speech production. As such, their characteristics correspond to a combination of the more or less pure defects described previously.